Chapter 7. Scientists test out what people perform after sleep deprivation. Randy Gardner's sleep experiment. He stayed awake for 11 hours and never had hallucinations or mental disorder. His speech was somewhat affected and he had trouble concentrating. The complete loss of sleep for more than a few weeks can be fatal, leading to weight loss, sickness, and sores. Sleep deprivation seems to disable the immune system, makes us vulnerable to invasions that it can normally handle just fine. Fatal familial insomnia is a human disorder caused by a gene that has no apparent effect in children or young adults and happens sometimes in midlife, which eliminates sleep. So you have less sleep, you have more panic and phobias, you're feverish, you lose weight, you become sick, and sometimes die. Shows that we cannot do without sleep. Some animals can sleep in half of their brain at a time, and some people can sleep just 1 to 2 hours a night. Sleep disorders can have mild effects or be devastating. Insomnia is the difficulty getting the amount of sleep needed. Sleep onset insomnia is difficulty falling asleep. Sleep state misperception is a disorder in which people report not having been asleep when they actually were. Sleeping pills are the most modern sleeping pills bind to GABA receptors, inhibiting broad regions of the brain. None of the drugs provide a completely normal sleep. With continued use, they lose their effectiveness due to tolerance. They produce marked changes in the pattern of sleep. Sleep drunkenness is when you're drowsy and impairs waking activities or memory gaps throughout the day. Ambient driver is sleep driving, and treatment for insomnia is to create a routine. Sleep maintenance insomnia is difficulty remaining asleep throughout the night, exacerbated by stress, drugs, coffee, tobacco, or alcohol. Sleep apnea is a sleep disorder in which respiration slows or stops periodically, waking the sufferer. Excessive daytime sleepiness may result from the frequent nocturnal awakening. Changes in neurons and brainstem, relaxation of muscles in chest, diaphragm, or throat are all symptoms of sleep apnea. Sudden infant death syndrome, or SIDS, which can also be called crib death, in babies arises from sleep apnea as a result of immature brainstems that normally pace respiration or from insignificant arousal mechanisms. Sleep patterns change across lifespan. Babies sleep at normal times of the day, random times of the day, not yet synced up to day and night. After spending so much time in the womb, they have increased wake time, increases with development, loss of amount of REM sleep with development. Sleep is important for growing children to fight up microbes they encounter each day. Biological processes underlie sleeping changes in our circadian rhythms as we grow. Older people tend to wake up earlier and sleep less, easy to fall asleep, difficulty staying asleep. Napping during the day may interfere with sleeping well at night. Hypnosis and meditation. Altered states of consciousness. Hypnosis is a process at work when one person, the hypnotist, suggests that another person will experience a particular perception or engage in particular behaviors. It's a social interaction. People cannot be hypnotized against their will. They cannot perform superhuman feats or do something they do not want to. There's a show of rhythms, and there's a show rhythms in EEG of relaxed brain. Little evidence for recovering memories, but ample evidence for distorting or creating false memories. Franz Mesmer, a Vietnamese physician, used magnets to treat patients while talking in a soothing voice. Found he could do this without his hands. Thought his hands were a magnet, waved his hands over the body in the healing waves of animal magnetism. He was discredited and died in poverty. Research for people to relax and attend someone's voice state. Mesmerism was renamed hypnosis, now considered a hypnosis who speaks to a participant. Hypnosis consists of 2 stages: induction of the hypnotic state and suggestion that you experience certain sensations or perform certain behaviors. People vary in their susceptibility to hypnosis. The Sanford Hypnotic Susceptibility Test is used to eliminate how readily a person can be hypnotized, basically by counting up how many hypnotic suggestions the participant follows. Good imagination helps, good at directing their attention, and they must be willing to try. The placebo effect is if the participant thinks it will work, it will be more likely to work. hypnosis can reduce pain. Some can undergo minor surgery under hypnosis, but they must be willing. Hypnosis suggests the participant regard painful stimulus in a detached manner. For people with long-lasting chronic pain, hypnosis is more effective. It suggested that pain is reduced and not gone altogether. Self-hypnosis and birthing hypnosis are also available.